Hi everybody, we have an interesting podcast today. We're speaking about heart diseases in the young population and in adults over 65 years of age. Today I have my colleague, Dr. Girish, interventional cardiologist from Apollo Hospital Bangalore. Dr. Girish, why don't you introduce yourself to the audience?
Hi friends, I am Dr. Girish Navasundi, Director Interventional Cardiology at Apollo Hospitals Bangalore. And I'm glad to be part of Dr. Anu's podcast today. And she's got interesting questions which she's divided into heart problems in young adults and elderly population. So we're going to have a good discussion.
Shall we start, doctor? Yes. So a lot of young patients come to my OPD. They're not even aware that they have a heart disease. And some of them actually come after a heart attack asking us, doctor, I underwent an angio. Around a decade ago, we never saw the young population actually come with any heart-related symptoms. So what has changed in the last few years?
Yes, that's a great question. I think, it's a myth to believe that so-called young people, that is between that's between 18 years to 35, are not vulnerable for heart disease. It's a myth. The fact is, any adult is vulnerable to heart disease. And heart disease can be of varied types: heart attack, heart failure, cardiac arrest. I think we'll start with heart attack because that's what most people are interested in knowing. Heart attack is a condition where the blood flow, the oxygen flow to the heart is severely reduced or stopped due to buildup of cholesterol or formation of a clot in the heart pipe that leads to damage of the heart muscle, making the heart pump weaker. At the same time, it can cause heart rate irregularity, at times stoppage of the heart, leading to sudden cardiac death.
I have another question. So there are youngsters between 18 to 35. All of them don't have a heart attack. There's only a particular subset of them which come with heart-related symptoms. Is there a difference as to why this population has a heart-related problem and the other population doesn't have?
Yes, again, a great question. I think in younger people, we must realize that 80% of the time, the risk factors that cause heart attack in elderly people are the same risk factor which are causing the heart attack, such as smoking, obesity, sedentary lifestyle, diabetes, hypertension, stressful living, and no relaxation, inadequate sleep. 80% of youngsters who have heart attack have same conventional risk factors which any other age group of people have for heart attack. But there's a difference in young people. There are 3 pipes which supplies the heart muscle. Elderly people tend to have blockages in multiple pipes. Younger people tend to have block in 80% of the young heart attacks. Only 1 pipe is blocked. So they tend to be injuring less and they survive better out of the heart attack. But long term, you should be worried that in about 15 years, 25% may not be alive. So the whole energy should go in preventing the very first heart attack. And looking at, apart from these conventional risk factors, there may be 2 young adults, means 21-year-olds, both of them smoking, obese, eating all kinds of foods, not exercising. But why one has heart attack, the other one does not have heart attack? This we call is the interplay between the risk factors and the human's genomic system, how his genes responds to these insults. I think today's youngsters live with impunity in terms of lifestyle, thinking that it's never going to harm them. But it's unfortunate. About 20% of them will be injured. Who, at what stage, is only a matter of time.
Is chest pain the only symptom in a heart attack or in any cardiac disease? Does he have to look for any other symptoms?
Yes. Again, this is another myth. Most youngsters as well as adults believe that if there is no chest pain, it's not a heart attack. But it's unfortunate. The typical chest pain is there probably in about 50% of the patients as the presenting symptom. In other 50%, the symptoms are different. Whenever the blood supply to the heart gets compromised, one of the discomfort, don't call it a pain, you call it a discomfort. Discomfort that a patient experiences is an uncomfortable feeling, most often in the center of the chest, sometimes to the left of the chest, more often in the center and both sides, spreading to upper abdomen, both the shoulders, both the arms and upper back, sometimes going up to neck and jaw. This is a discomfort of angina. Apart from this pain or discomfort, another 1/3 of the patients can have atypical presentation. They may just have breathing difficulty or easy tiredness, excessive sweating or perspiration, and some of them have just abdominal discomfort and nausea and vomiting. They come and tell the doctor, I have acidity. Treat me for acidity or gastric. Unfortunately, doctor treats the diagnosis of the patient and they worsen. So these are the symptoms that any common person should be aware. Do not ignore any discomfort that is there above the umbilicus and below the jaw, whether front or back.
So it need not be just a left-sided, it could be even a right-sided chest pain.
Absolutely.
Yeah, because most patients seem to think that only a left-sided chest pain is cardiac and not the right-sided chest pain. So do we have any other modalities? How do we treat these chest pains who come? We do an ECG in the OPDs. Are there any other ways we can treat and diagnose these heart ailments?
Absolutely. I think we need to understand the greatest chance of preventing injury to the heart is recognition by the patient that I need to seek a medical advice. That's the most important. Do not ignore the symptom. Do not self-diagnose, self-treat. That's the first component. Second, go to a place where a cardiac consultation can be available by an expert like you or a cardiologist, and do the routine tests like heart rate, blood pressure, look at the lung, auscultation by a stethoscope, do an ECG, echocardiogram. These are very conventional tests which have been there for more than 5-6 decades. But today we have moved forward. There are more sensitive tests which can detect very early stage of heart attack or a probability of heart attack through blood tests like troponin, CKMB, myoglobin. There are these tests. There are also better tests today like stress thallium, and then we also do CT coronary angiograms. I think today the best screening tool for anybody is a CT coronary calcium score and CT angiogram, because for a stress test to be abnormal, you need to have a block exceeding 50%. In all those patients where a stress test, ECG, echo is normal, 50% of them can still have a block less than 50%, and we'll brand them as normal. They can have heart attack anytime in the future. But if you do a CT scan, most can be detected.
So there are new technological wearables which have come in the market. How accurate are they, and how good they are? How are they good for the general population?
I think we are trying to recognize cardiac abnormalities at varied times. Many a times when a person comes with a chest discomfort or breathing difficulty, you may do an ECG or an echocardiogram, which represents the function of the heart at that second, that point in time. At that point, his heart rate may be normal, blood pressure may be normal, the blood flow may be normal. He walks out after 2 hours, it could become abnormal. So that means, did we miss it? Yes. That is why we are looking at monitoring patients outside of contact period when they come in contact with a doctor. So we're looking at these variables. There are something, most often these variables are used for two important disease detection. As I said, heart can have disease in terms of heart attack, which is decreased oxygen supply, but also it can have another two diseases called arrhythmia, that is irregular heartbeats. It can be too slow, too fast, or irregular, which harms the body's oxygen supply. At times, if the heart rhythm becomes very slow or very fast, the patient may become unconscious. So these can be diagnosed by these variables. And also, in terms of blood pressure management, a person's blood pressure keeps varying from the moment he wakes up to the morning period, afternoon, evening, workspace, coming back home, during his sleep. The variation in the blood pressure can be better assessed by variables. So these are the times then when we use these variables to predict one's risk for future sudden cardiac heart events and strategize their prevention and treatment.
Very nice. Doctor, we have youngsters who are fitness enthusiasts who come to our OPD asking that whether a cardiac screening is required prior to joining a gym. What is your take on it?
Excellent. I love these guys. Whoever wants to exercise, do marathon, go to gym, they're the best example in the community. But they also need to take a few precautions before you challenge your body and acclimatize it to work optimally. Every adult from the age of 18, I think once at least you should do a cholesterol, blood sugar, blood pressure, heart rhythm, and undergo a medical treadmill test where a person is put on a treadmill made to run, and his response, his body's response to stress is recorded in terms of variation in his heart rates, variations in blood pressure, and also oxygen supply to his heart muscle. Apparently, many young adults are born with certain heart disease which manifests only in adulthood, such as atrial septal defect, bicuspid aortic valve disease, some arrhythmogenic disorders of the muscle, cardiac muscle.
So could you be a little more specific as what is arrhythmogenic disorders of the cardiac muscle?
Absolutely. As we both are aware, the heart has four components: the muscle which pumps the blood pipes which supply oxygen to the heart called coronary arteries. Third, the electrical circuit of the heart is called cardiac electrical conduction system. And fourthly, they're called valves in the heart, which maintain the blood flow in a unidirectional manner so that the blood pumped forward should not come back. There are four components: muscles, blood pipes, electrical conduction system, and valves. If one of this component is not working well, it can be dangerous to patient's health, a person's health. He is not yet a patient. So there are ways to, diagnose each of these abnormalities. Some are very simple, but some are very complex. But any young adult who wants to explore high intensity exercise, I think they need a proper evaluation before they embark on this. So we look at their heart muscle pumping capability by an echocardiogram, screen for defects of the heart by birth.
Right.
Third, we look at the heart's response to stress, and we also look at the electrical abnormalities in these people.
So he should be doing an ECG, an echo,
exercise treadmill, and then what we call, if feasible, a CT coronary calcium score to prevent sudden cardiac events.
Are these tests only for those who are fitness enthusiasts, or these can be run as a screening test for all individuals between 18 to 35 years?
See, the guidelines which apply to large population has to be economically viable. You can't do every test for everybody, but you especially invest your more energy and resource on those who are more vulnerable. How do you decide these vulnerable young adults between 18 and 35. I think those in whose family there has been a heart disease, in whose family somebody has had a heart attack, heart failure, or sudden death, I think you need to investigate them more intensely, both in terms of their cholesterols, blood abnormalities, cardiac functions, even if they're just 18 years old, and cultivate better lifestyle in them so that their future lifetime risk of heart disease becomes less. Next, invest more energy on those who are not apparently healthy, means those who are obese, sedentary, smokers. Today you have these heart attack risk score available. So if somebody is very fit, no family history, plays very well, eats responsibly, I think they may be less investigated than others. But it does not mean a person who eats very healthy, exercises, meditates, sleeps well, is not going to have a heart attack.
So to conclude, Dr. Girish, what are the things that young adults should be aware of? What are the preventive measures they can take? And what should they be doing and not doing to prevent a heart disease?
I think excellent question. From the young adulthood, all of us need to live with sense of vulnerability. That means to say, things can go wrong with me. I should do everything in my capacity to prevent any health disease, more so heart disease. Because heart attacks can be deadly. They don't give enough time to reach a hospital too. My request to all young adults is, practice a healthy lifestyle. Eat well, eat responsibly. Large portion of the food should include fruits, veggies, low carbohydrate, high protein, and high quality, small amount of fat. And exercise on a regular basis, at least 45 minutes a day. Sleep adequate, at least 6 to 8 hours without interruption. And watch your weight. It's very, very crucial. And please never, never, never smoke, because this one habit can kill patients in multiple ways. Heart attack, cancer, brain strokes. It can cause many things. Alcohol, preferable to avoid, but social drinking is acceptable. That's one aspect. Second, I think whenever there are symptoms, please bring to notice of your family physician or a specialist, because symptoms ignored can progress the disease faster and the treatment can become more complex and incomplete. At times, it may even cause loss of life. Thirdly, be aware and to do an annual health checkup.
True.
I think that's one way of knowing how my body is doing today and what should my next 1 year goal before I do the next health checkup to achieve and stay within that safe zone. We need to define our safe zone in terms of what's my body weight, what's my heart rate, my blood pressure, my cholesterol, my sugar, so that I don't get heart attack, paralysis, dialysis. So what is this safe zone and how to live within that? So I think health checks are a great tools for that.
So to conclude, it's a myth to say that heart disease is not prevalent in young adults, and it's only prevalent in the older age group is actually wrong.
Absolutely. It's a great myth. And today, any young adult should believe I'm as much vulnerable as anybody else for heart disease or any other disease. So our lifestyle should start changing from the day I become an adult, 18 years. Thank you.